Welcome to the Deep Dive. We're here to extract the most important nuggets of knowledge and insight from our sources, helping you get instantly well-informed. Sometimes the most critical roles in any complex endeavor, they aren't the ones right in the spotlight.
Hmm.
We often celebrate, say, the star athlete, but what about the perfectly timed pass from that unseen teammate? Or the brilliant chef without really acknowledging the prep work of the sous chef?
Right, the unsung hero.
Exactly. Today, we're diving into a world where that kind of precision is literally life and death stuff, the operating room. More specifically, we're taking a deep dive into the fascinating world of laparoscopic surgery. Our source material for this is really insightful. It shines a light on a role that's absolutely crucial, yet, often overlooked, maybe even dismissed as passive sometimes.
Yeah, I've seen that perception.
And it gives us this incredible analogy to help understand it. Picture an old man trying to thread a needle through a lens.
That's a striking image.
Isn't it? It just instantly captures the challenge, the delicacy needed when you're doing intricate work from a distance. So our mission today is to really unpack this analogy. We want to understand exactly why the person operating the scope, the cameraman, as they're often called, why they're so vital in these surgeries. We'll find out how their precise actions, often really intuitive, can literally make or break an incredibly delicate procedure. This deep dive is all about exploring that often invisible but totally indispensable partnership that makes these complex, minimally invasive operations possible.
It truly is a fascinating area. Because like you said, on the surface, it might seem pretty straightforward. You might just picture someone holding a camera still.
Right.
But as our research shows so well, it's anything but simple. Maybe we should quickly set the scene with laparoscopy itself.
Good idea. Just a brief overview.
Okay. So for those maybe less familiar, it's a type of minimally invasive surgery. It really revolutionized a lot of procedures. Instead of one big cut, surgeons make several tiny ones, maybe just a few millimeters long.
Tiny incisions, yeah.
And through these, they insert specialized tools, including a thin tube with a camera and light. That's the laparoscope. This camera sends a magnified picture of what's inside onto a video screen in the OR.
So the surgeon operates by watching the screen.
Exactly. They watch the screen and move instruments inserted through the other small holes. The benefits for patients are huge: less pain, smaller scars, much faster recovery. But, and this is key, this whole approach introduces some unique challenges for the team, especially around, seeing and feeling.
And that's precisely the core challenge, isn't it? Our sources really hammer this home. In laparoscopy, the eyes and the hands are separated by the camera. Just think about that for a second. It's profound.
It really is.
In traditional open surgery, the surgeon's looking right at the tissue, they're touching it, feeling it, you get that immediate feedback.
Yeah, direct connection.
It's intimate, unmediated, a natural extension of how we work. But in laparoscopy, that link is just severed. You've got this technology in between the camera, the screen. It creates this deep kind of unnatural separation between seeing and doing.
And that fundamentally changes the game cognitively and physically for the whole surgical team.
Precisely. And this separation, it has these significant cascading implications. The cameraman or the assistant holding the scope, they effectively become the surgeon's, their second pair of eyes.
A surrogate vision system.
Yeah, exactly. And think what you lose with that direct vision gone. You lose things like natural depth perception. Our brains just handle that automatically in 3D space.
Right, judging distance.
That vital skill, understanding how things relate in 3 dimensions, it's severely hampered on a flat 2D screen. You also lose that direct tactile feedback, feeling the tissue texture, the tension, the resistance with your fingers.
All that rich sensory info is gone.
It's all filtered, interpreted, and shown on a monitor, and it's entirely controlled by someone else. The surgeon's entire visual world, how they navigate, their understanding of the field, it's completely dependent on what the cameraman shows them and how well they show it.
It's a remarkable dependency.
A total re-engineering of perception in a critical situation. And this isn't just a minor inconvenience, is it? The stakes are incredibly high. Our research really underscores this. There's this powerful saying, often repeated by senior surgeons: the cameraman makes or breaks the case.
You hear that a lot, and it's true.
It's not hyperbole, it's just stark reality. When you think that the surgeon's entire view, their window into the patient, is mediated by someone else, it becomes crystal clear why this role has such a massive impact.
Absolutely.
If that view isn't stable, if it's not clear, if it's oriented wrong, or if it doesn't anticipate what the surgeon needs next, even the best surgeon can be, seriously hindered.
Hamstrung.
Yeah,
essentially.
and that can lead to longer operating times, which brings its own risks, more frustration for everyone, and critically, a much higher risk of complications, compromising patient safety.
That saying really nails the gravity of it. It's not just about the surgeon's skill alone. It's about the environment created for that skill. If the visual environment is poor, even a hugely experienced surgeon will struggle. They'll get frustrated, feel like they're working blind.
Mm.
Imagine, just for a moment, you, the listener, trying to do something really delicate, maybe repairing a tiny circuit board or carefully carving wood.
Okay.
But your vision is completely dependent on someone else controlling a camera pointed at your hands,
Yeah.
moment by moment.
Wow. Yeah, that would be tough.
You'd need incredible trust, coordination, almost telepathy to succeed, wouldn't you?
Absolutely.
That's precisely the kind of synergy needed in the OR. That adage highlights the immediate, profound impact. The surgeon has the ultimate skill and responsibility, yes, but their ability to use that skill is directly enabled or disabled by the quality of the view from the cameraman.
A testament to how collaborative modern surgery really is. Every role matters.
Critically matters.
Which brings us back so powerfully to that brilliant analogy, an old man peering through his spectacles, trying to thread a needle. It sounds quaint at first, but it beautifully captures the essence of what's going on. Let's break down why it fits so perfectly.
Okay, well, let's think about any kind of fine work, whether it's threading that needle or a watchmaker's job or microsurgery. What do you always need?
Precision.
Right, and what enables precision? First, you need close-up clarity. You have to see the tiny details. The eye of a needle is minuscule. So are many structures surgeons work on: small blood vessels, nerves, tissue planes.
Things you can't really see well with the naked eye.
Exactly. Second, you often need magnification. An old man might use spectacles, right? Or a jeweler uses a loupe.
To make the small target bigger, clearer.
Yes. Third, steadiness is absolutely paramount. Any tremor, any wobble,
Mm.
either in the tool or the target, means failure.
Can't thread a needle if your hand's shaking or the needle's moving.
Impossible. And finally, you need perfect alignment. The target, the needle's eye, the tool, the thread, and your view of both. They all have to be perfectly lined up.
In sync?
If any one element is off, even slightly, the task gets exponentially harder, often impossible. These are just universal rules for precision work.
That's a great breakdown. And this is where the analogy just clicks, because every single one of those requirements translates directly to the cameraman's job in laparoscopy. Let's connect those dots. The camera, held by the cameraman, provides that essential magnification and clarity.
Right. Without it, the surgeon's blind to the micro-level stuff.
But it's not just having the camera there.
Yeah.
The operator controls where the clarity is focused, the lighting, how much magnification, a blurry image, a foggy lens, too dark, too bright. It instantly hinders the surgeon. They can't see landmarks, subtle tissue changes. That's dangerous.
Very dangerous.
Then there's steadiness. The surgeon's hands might be rock steady, years of practice. But if the image on the screen is shaking or drifting...
Their own hands can't be precise.
Exactly. Our sources say the steadiness of the cameraman's hand is paramount for the surgeon's hands to be steady. It's like trying to write perfectly while someone's jiggling the paper.
Mm-hmm. And think about the mental load that creates.
Yeah.
The surgeon isn't just focused on the surgery. They're also mentally compensating for this unstable view, trying to predict where things will be.
That must be exhausting.
It increases cognitive load, leads to fatigue, and directly impacts their fine motor control. A tiny tremor from the cameraman can look like a huge, uncontrolled lurch on screen.
Potentially hitting something vital.
Precisely. That cognitive load is a huge factor. If the view keeps shifting, a big chunk of their brain power is spent just reorienting, guessing, waiting for a clear shot.
Instead of focusing 100% on the procedure.
Right. It slows everything down, increases operating time, and bumps up the risk of error significantly. And maintaining that steadiness, it's physically demanding for the cameraman too. Holding that scope still for hours, often in awkward positions.
Yeah, definitely not a passive role. And finally, that perfect alignment. Just like the old man needs the needle's eye right in his view.
The cameraman makes sure the surgical target, the bit they're working on right now, the vessel to clip, the tissue to cut, is perfectly centered and clear on screen.
It's about presenting the right view, at the right magnification, and the right orientation at the right moment.
Requires an almost intuitive grasp of what the surgeon needs next.
Without that alignment, the surgeon's basically guessing, and you can't guess when you're working near vital organs.
No. Any misalignment wastes time, causes frustration and increases risk.
It's such an elegant comparison. It really drives home that the cameraman isn't just holding equipment. They're actively creating the surgeon's visual reality.
Architect of the visual field, moment by moment.
Yeah. And that's critical because it busts that common myth, doesn't it, that the role is passive, like a tripod.
Oh, absolutely.
Our research is emphatic. This is dynamic, active work. It demands a whole lot more than just holding still, a real skill set.
Totally. The ideal movement is described so carefully, gently, slowly, predictively, not in sudden jerks.
Let's unpack that gently and slowly. Why are those so key?
Well, think about the scene on screen. Delicate work. Instruments millimeters from something vital. Then bang, the image lurches.
Instant disorientation for the surgeon.
Exactly. Loss of focus. Huge risk of the instrument slipping, causing damage.
Right.
A sudden jerk can make the surgeon completely lose their bearings inside the patient.
Okay, so gentle and slow makes sense, but predictively? That sounds advanced. How do you move predictively in surgery?
That's the really fascinating part. It implies this deep understanding of the surgical flow, knowing the anatomy, anticipating the surgeon's next step. It means the cameraman needs to be thinking ahead, figuring out what view will be needed next, not just reacting when told.
So they're not just following orders.
Not the best ones, no. They're anticipating. This comes from experience watching tons of procedures, building a mental map of how things usually go, maybe even knowing that specific surgeon's habits.
Wow. It shifts the role from just technical operator to, like, a cognitive partner.
Absolutely. Predicting needs before they're even spoken.
That predictive element is huge. And another critical skill the sources highlight is dynamic zoom. It's not just holding still, it's adjusting the view. They say, come closer during dissection, move back during sweeping or clipping. Why is changing the zoom level so important?
Well, think about dissection. You need that super close-up magnified view. You're seeing tiny details, tissue layers, small vessels, nerves you have to protect.
Like using a microscope.
Pretty much. You need that granular view for safety and precision. But then maybe the surgeon needs to check for bleeding over a wider area or apply a clip to a larger structure where they need to see its connections.
Then the close-up is actually unhelpful.
Right. You need to pull back, widen the view, see the bigger picture, assess the situation, make sure everything's okay, or get ready for the next big step.
So it's not just a technical skill, clicking a zoom button.
No, it shows a real understanding of the surgical flow, what the surgeon needs right now. It's like being the director of photography for the operation.
Knowing when to go for the close-up, when for the wide shot.
Exactly. Telling the visual story, serving the surgeon's immediate needs. And often, it's based on nonverbal cues. A slight shift in the instrument, a pause. The experienced cameraman reads that and adjusts the view.
Amazing. And then there's orientation. Keeping the horizon steady. The analogy comes back, just like an old man keeps his glasses level to focus. What does keeping the horizon steady actually mean here, and why is it so critical?
It means keeping a consistent up-down, left-right orientation on the screen, basically stopping the image from tilting or spinning. If the camera tilts, the whole world on the monitor tilts. What was up is now diagonal. What was right might be upside down.
That sounds incredibly disorienting.
It is hugely disorienting for the surgeon. Imagine trying to walk through your living room while someone keeps tilting your head violently.
You'd be bumping into furniture, feeling sick.
Right. In surgery, it makes navigating instruments incredibly confusing.
Yeah.
The surgeon has to constantly remap how their hand movements translate to the screen.
Adds a massive cognitive load again.
A huge one. They waste mental energy just trying to stay oriented. Instead of focusing on the surgery itself, it turns intuitive actions into a difficult puzzle.
Increases risk of errors.
Absolutely. A stable horizon lets the surgeon's brain process the visual info almost subconsciously. It frees them up. A shifting horizon can even cause something called endoscopic vertigo.
Vertigo, seriously?
Yeah, it's a real thing. Nausea, disorientation, it slows things down, adds stress, increases risk.
Wow. So the cameraman is literally creating the stable world the surgeon works in, a cognitive anchor.
That's a great way to put it, an anchor in a visually mediated reality.
And this brings us to what I think is a real aha moment in the source material. A teaching pearl that just reframes everything. It moves beyond our usual idea of surgical skill. The sources state, laparoscopy is not just hand-eye coordination, it's eye-eye-hand coordination.
That's the core insight, isn't it?
It really is. We think of hand-eye coordination as the gold standard for skill sports, music, art. It's direct, me seeing, me doing. But eye-eye-hand, what does that truly mean in the OR? How does it change things?
It's a brilliant summary of the unique challenge and the deep collaboration involved. In normal hand-eye coordination, my eyes see, my hands respond. Direct neural loop. Simple.
Right.
But in laparoscopy, that loop gets, well, it gets extended and includes someone else. The surgeon's eyes aren't seeing directly. They're piggybacking on the cameraman's eyes.
Ah, okay.
So the sequence is, cameraman's eyes see via the scope.
Mm-hmm.
Image goes to screen. Surgeon's eyes see that image, framed by the cameraman. And surgeon's hands respond.
Hand. I see it now.
It underlines this absolute dependency. The surgeon's motor skills, their precision, it's all downstream from the cameraman's visual input.
A relay race of vision and action.
Exactly. If there's a break anywhere in that chain, the whole thing is compromised. It's a fantastic example of distributed cognition. One person seeing enables another's doing.
And the consequences for efficiency and safety are immediate. The sources contrast it so clearly. If his eyes are steady and near the target, my work becomes smooth.
That's the ideal. Perfect visual input, steady, clear, aligned, responsive.
The surgeon can just operate. Fluid movements, confidence, accuracy, their skills shine.
They can focus entirely on the task. No visual distractions, less cognitive burden, leads to shorter operations, less trauma, better outcomes, less stress for everyone.
It allows that state of flow.
Precisely.
Yeah.
Working with the visual field, not fighting it. But the flip side, the consequence of failure in that eye-hand chain.
Yeah.
It's equally stark, the sources say chillingly. If not, I'm trying to sew in the dark.
Sewing in the dark. That's a terrifying phrase in surgery.
Isn't it? It implies the operation becomes slow, difficult, longer anesthesia time, more risk, immense frustration, psychological toll on the whole team. You can feel the tension rise.
And the risk of error skyrockets.
Dramatically. Accidental injuries, missed bleeds, turning a routine procedure into a dangerous ordeal.
Mm-hmm.
The dark isn't just literal lack of light. It's the cognitive darkness of uncertainty, losing control.
This whole concept really forces a rethink of surgical skill. It's not just one person's dexterity, it's shared control, symbiotic.
Distributed cognition in action, under immense pressure. A shared brain trust, almost.
Which leads us to think about the camera itself, not just as gear, but as the invisible instrument. It's not just pointed, it's wielded. With skill, intention, like an extension of the surgeon, but providing the sight, the conduit for everything.
That's right. And the sources give some very practical tips for mastering it. Treating the camera like a delicate instrument itself. First, the basic but critical advice. Keeps the lens warm and clean.
Seems obvious, but why so vital?
Well, the cold lens hitting the warm, humid abdomen. It fogs instantly, like glasses in a steamy room.
Right. Obscures the view completely.
Instantly. Or smudges debris. Same effect. Dirt on the old man's spectacles. It forces them to stop, pull the scope out, clean it, put it back. Wastes time, breaks the flow, increases infection risk. So basic maintenance is absolutely fundamental.
Okay, warm and clean. Got it.
Yeah.
Then there's this piece of advice that seems counterintuitive, maybe. Follow the surgeon's instrument, not the gallbladder. You think you just keep the target organ centered, right? Why follow the tool instead?
This is a key difference between a novice and an expert cameraman. If you only focus on the gallbladder, the surgeon might be working with their instrument tip just outside that main view.
Ah, I see.
The surgeon needs to see exactly where their instrument is interacting with tissue, the point of action. By following the instrument tip, the cameraman ensures the surgeon always sees their working end clearly, magnified, allows precise control, avoids hitting things nearby that might be off-screen otherwise.
So you're showing the action, not just the static scene.
Exactly. And high definition as it happens.
Right.
Requires anticipating where the surgeon's going next.
That makes total sense now. And it reinforces that anticipation idea, doesn't it? Anticipate when to zoom in and when to widen. It's not just technical, it's awareness.
Definitely. Understanding the rhythm of the surgery, knowing that after a wide look, a precise dissection usually follows, so you need to smoothly zoom in. Or, after a delicate fit, knowing the surgeon might need to pull back visually, check for bleeding, get bearings for the next step.
That anticipation turns the cameraman into a real collaborator, a co-pilot for the vision.
Often reading subtle cues, posture, instrument angle, interpreting needs without words.
And finally, repeated advice. Keep horizon steady, don't tilt unless told. Back to that core principle. Consistency is king, unless specifically directed otherwise. Maintain that stable world.
It's foundational.
But maybe the most profound instruction, the one that pulls it all together, is think like the surgeon's third hand. What does that really mean? To think like a third hand in that environment, how do you achieve that?
It implies this incredible intuitive understanding, seamless collaboration, a shared mental map of the procedure. A literal third hand wouldn't just hold something passively. It would anticipate, position itself perfectly, move in concert with the other two, often without conscious thought.
Right, it just knows what's needed.
Exactly. For the cameraman, it means not just moving when asked, but knowing when and how to move, what the surgeon needs to see, zoom, angle, often before they ask. It means internalizing the plan, knowing the anatomy, almost feeling the surgeon's focus shift. It comes from shared experience, trust, communication, verbal and nonverbal, becoming truly integrated into the surgeon's cognitive loop.
It really is like a top sports team, the quarterback throwing to where the receiver will be, thinking as one.
Or a flight crew.
Yeah.
The co-pilot, monitoring, anticipating, maybe acting before command if needed.
Yeah, but the stakes here. Patients' well-being, life itself. It's extraordinary collaboration under pressure.
It truly is.
So, as we wrap up this deep dive, let's circle back to those poetic closing thoughts from the source material. They really synthesize everything beautifully, bringing us back to that central image. Laparoscopy is like an old man peering through his spectacles trying to thread a needle.
Such a perfect summary.
And then it elaborates. The surgeon's hands are steady, but the needle's eye is small. The cameraman is the spectacles. If he tilts, fogs, or drifts, the thread will never pass.
It powerfully captures the fragility of that visual link. Every point we've discussed, steadiness, clarity, orientation, anticipation, contributes to making those spectacles work. If the cameraman tilts, surgeon's disoriented, lens fogs, surgeon's blind, view drifts, needle's eye vanishes. Any tiny lapse, any failure in that visual guidance makes the task impossible. The thread, the successful, safe maneuver just won't pass. It shows how critical that invisible instrument and its operator are.
And then the sources give us the ideal outcome, the positive result of perfect synergy. Distilling the advice, bring the lens close, keep the horizon straight, and let the surgeon's fingers find their way. It sums up the cameraman's job. Provide the perfect, stable visual canvas so the surgeon's skilled hands can just work. Unimpeded, confident, precise.
Let them do their art.
And this leads to that beautiful final description. In this quiet partnership, the operation becomes smooth, almost musical.
Yeah.
Musical. What does that really mean in surgery? What does that harmony feel like in the OR?
Musical here suggests rhythm, harmony, effortless flow. Perfect timing. Every camera movement synchronized with the surgeon's actions. Seamless, choreographed. No jarring moves, no hesitation, no wasted motion, no shouting commands.
Like a symphony.
Exactly. Each part playing its role flawlessly, anticipating the next note, blending into a cohesive whole. When it's musical, the surgeon is in that flow state, hands moving confidently because the view is exactly right, exactly when needed. It cuts stress, boosts focus, improves outcomes, makes things efficient. It's built on trust, nonverbal cues, mutual understanding, deep respect for interdependent roles, collaboration at its finest.
And that's what the deep dive is all about, isn't it? Pulling back the curtain on these intricate relationships, these hidden complexities, we've really explored the underappreciated complexity and absolute criticality of the cameraman's role today. It's a powerful reminder that in specialized fields, seemingly supporting roles can be totally central to success. It makes you rethink what skill even means. Often it's distributed across a whole team.
Indeed. And exploring this role, it makes you wonder, doesn't it, about all the other invisible instruments or second pairs of eyes in our own lives, our own work. Whether you're leading a team, managing a project, even coordinating family stuff. Where might you be relying on a quiet partnership, a crucial support role you haven't fully recognized? How could seeing and valuing that contribution, understanding its impact on your own ability to perform, make your own operation more musical, more harmonious, more successful?
That's a fascinating lens to view collaboration through in any high-stakes situation.
Something to think about.
Absolutely. Definitely something for all of us to think about how we can make our own operations more musical. Thank you for joining us on this deep dive. We'll see you next time.